I've said that keeping Tasmanians safe and secure is our number one priority. We've made it very clear to Tasmanians over the course of this journey that if and when necessary, we will take additional steps to ensure that we can get on top of this, that we can flatten the curve, that importantly we can keep Tasmanians safe. With the current outbreak in the northwest of Tasmania a serious concern, we need to take immediate steps to stem any further potential spread. In terms of the 133 current positive cases that have been recorded here in the state, obviously and unfortunately 5 people have died, but 61 of those cases are linked to the northwest coast, 49 of them are linked to this health outbreak and 35 of them are healthcare workers themselves. It's important that we take steps to get on top of this, to protect not only the people that live on the northwest coast, their families, but that we take the steps necessary to protect the rest of Tasmania as well. We'll be outlining a plan to secure Northwest health services this afternoon, and more detail will be provided by the Health Minister and the State Health Commander. But in effect, what this plan will do begins with a closure, a temporary closure and deep clean of the Northwest Regional Hospital and the Northwest Private Hospital. As part of this plan, all Northwest Regional and Northwest Private Hospital staff and their households will be required to undergo 14 days of quarantine isolation from their last day of work. We expect that this will be more than 1,000 people that will need to be isolated, and as well as their families as well. And so a significant number of people on the northwest coast will be moving into quarantine and self-isolation. I want to say that I'm sorry that we've needed to do this, but at the end of the day we need to get on top of this. We need to ensure that we can crush this virus at its source, and with this outbreak we need to take these steps. In order to retain as much hospital capacity as possible, we are expanding and bringing additional staff into the Mersey Hospital to allow it to take the vast majority of patients from the Northwest Regional Hospital through this period. There will be a limited few that may have to go to other hospitals in the state, and that will depend on whether or not the Mersey is able to provide them with the care that they need. For example, if you were a cardiac patient requiring the services that only the Royal could provide. Patient and staff safety is our number one priority. With any transport of patients to be treated with full precautions, in effect treated as if they have coronavirus. We will be ensuring that our staff and our patients are treated in terms of the seriousness of this, with the seriousness that it deserves. The Health Minister will make some statements and provide more clarity in terms of the plan in a couple of moments. But to secure the health, safety and the protection of the Northwest community, we need to take further steps as well. We will be putting in place additional, stronger restrictions in terms of the Northwest community effective at midnight tonight. These further measures will impact on retail and broadly be spread right across the retail sector, but I'll come to that in a moment. In terms of the significant outbreak, and again, I do want to apologise to people on the northwest coast. This will mean that your lives are going to be interrupted. It means that in some cases you will be in self-quarantine for a period of 14 days with your family, and then obviously close contacts will be self-quarantined as well. This will be a difficult period. I would ask you to work with us. The aim of this is to get to the end of a 2-week period where we can bring those health services back online, and importantly that we would be able to lift the restrictions as well. But we need to do this, we need to do it now, we need to get on top of it, and I make no apologies for that, nor the swiftness of the action that we're taking. In terms of retail and business closures in the northwest, from midnight tonight, additional restrictions will be implemented for a period of 14 days across these municipal areas: Latrobe, Kentish, Devonport, the Central Coast, Burnie, Wynyard Waratah, Circular Head and the West Coast. Under these new restrictions, the following will apply. For individuals, the rules won't change. We want you to stay at home and only leave your home for essential purposes. If you don't need to go to work, if you don't need to go out for essential supplies, if you don't need to go out for medical services, if you don't need to go out for exercise, over the next 14-day period while schools are on holiday, stay home and save lives. Stay home and do the right thing by your community, by yourself, importantly by your family and by your friends. In terms of compliance in regards to the stay-at-home message, police will continue to pay special attention to the North West Coast in terms of the stay-at-home message. Don't be surprised, as many of you would know, over the Easter period, hundreds of Tasmanians have been questioned by police. 23 people have been arrested by police for breaching these rules. The police will pay special attention to the North West Coast through this period. In terms of businesses, additional business restrictions affecting most of the remaining retailers will be implemented. These measures are aimed at reducing customer-facing interactions wherever possible. All remaining retail businesses on the North West Coast will now be required to close unless they offer online or home delivery services from midnight to night. There are a range of exceptions, and I want to be clear in terms of those. Exceptions will be provided for those providing essential services such as medical services or pharmacies, supermarkets, businesses that provide food such as greengrocers, food and takeaway businesses. Service and petrol stations will be able to remain open. Bakeries, which will fall into that food bracket as well, will be able to remain open. Laundromats and dry cleaners, newsagents, rural services and general stores, bottle shops, IT repairs, car repairers, but new and used car sales are closed, veterinary services to look after animals and animal and pet food supplies, and banks. Everything else will be closed. Obviously, those businesses that close, if they can provide online sales and home delivery, then that is for them to work their way through. But I want to be clear, Kmart, Harvey Norman, Target, other big box retailers will all close. In terms of trade supply stores, including Bunnings, they will only be able to sell to trade customers only. I want to be clear about that. Trade supply stores, including Bunnings, will only be able to supply to trade customers only. If you operate a retail business that does not fall into these categories and you are unable to offer online sales and home delivery, then you must close. Exemptions will be able to be applied for, but they will be looked at very closely. Local government services will continue to operate as determined by each local council. There will be an order under the Public Health Act which will take effect from midnight tonight, and this will contain the details which I've just announced, will be communicated clearly in newspaper advertisements and radio announcements beginning tomorrow. I want to provide strong guidance for people in terms of these changes. Protect your family, stay close to your home. If you can, don't travel out of your the location around where you live. Certainly don't take this as an opportunity to believe that what you can do if you were thinking about shopping at Bunnings is drive to another Bunnings store in the state. Do not be surprised if police ask what you're doing, where you're going and what the purpose of your trip is, and if it's not an essential trip, then you can expect the full force of the law to be brought down. I want to say, and in terms of both the staff that will be quarantined, I'm sorry that we have to do this. But please work with us. We have a goal that over a 2-week period that we can return to some semblance of normal. And I would ask that you work with us through that period. It will be difficult, it will be tough, but we need to do this for the benefit of both yourself, your families, and the broader North West community and the state. In terms of those businesses, I would hope that at the end of this 2-week period, beginning midnight tonight, that we would be able to lift some of those restrictions. We will keep it under review, and again it will be determined by whether or not there is community transmission occurring across the North West Coast. It is important that we do everything that we possibly can to stamp this out right now. And I make no apologies for the measures that we're putting in place. They are firm. Some people will see them as being harsh, but at the end of the day, we need to get on top of this. We have an outbreak. Unfortunately, for a state that has done, in my view, everything right, and we've taken steps before other jurisdictions, but now we have this outbreak, what we have to do is manage it, get on top of it and beat it. And I would ask that all North West coasters work with us whilst we do this.